Hello, how are you doing? Obviously, if you're watching this video, we are suspecting that you have vertebral subluxation, or we've already seen on X-ray that you do. And so this is an instructional video on some of the things that you'll have to make decisions about on your care going forward. Now, we have a lot of information to cover. I highly recommend pausing the video right now. And, if you have a spouse or a significant other or somebody that's going to be part of your healthcare team and give you support, or part of this decision making process, or they want to know what the heck is going on with you, pause the video right now, bring them, and then get started. And we're going to get going right now. um, so first off, just a little bit of background about me. I'm traditionally trained as a chiropractor. My name is Dr. Michael Thompson. After chiropractic school, I did a lot of postgraduate training in nerve system correction and spinal biomechanics, sports nutrition, um, exercise physiology, toxicity, and detoxification of the body. Basically, a lot of additional postgraduate training. I was lucky enough to be selected to serve on the Wellness Advisory Council, which is a group of doctors that takes care of our Olympic athletes. So I did that for 4 years. I worked with the USA Wrestling team, the USA Judo, the Colorado Rapids. That's the soccer team down in Denver, USA weightlifting. But I don't say that to brag. What I want to explain to you is that, you know, they have people in those organizations to take care of pain, and what I want you to understand is that we are all about trying to get function. These athletes that we deal with and that we treated, basically they have the highest level of health than anybody, but we're all about trying to get to 100% function, because if we look at the body here, if you have 100% function, you have 100% life and 100% health. When you have 0% function, that's when you have death. So when we're dealing with these athletes, they're doing all the stuff that I'm going to teach you today, and I teach all my patients, is trying to increase the function of your body. Now, when these athletes do that, they're looking for any sort of competitive edge. They want to get a little bit faster, a little bit stronger. They're trying to win more gold medals and world championships. When my patients do the exact same thing, their level isn't like the athlete. Their level is down here. But when we do the exact same things and start increasing that function of the body, that's when they no longer have pain, but they no longer have high blood pressure. They don't have type 2 diabetes. They no longer have asthma or allergies and things of that nature, because your body's a self-healing, self-regulating organism. We just need to do some lifestyle changes, and we'll get into what we do with this here a little bit later. So that's a little background about me. Let's get going. Before we can get going on what health is, first we have to really explain to you some myths on what people are told health is in our country, okay? And even before that, I want to also tell you that we are on a mission here in our office. We're on a mission not just to treat pain, but to save lives by increasing that function, both physically and financially. That seems a little strange right now. This will make a heck of a lot more sense as we go on, and you'll learn a little bit more about true health and healing. So what we're told in our country is that our healthcare model is all about based on symptoms. You wait until you get a symptom, and then what do they give you to treat the symptom? They give you what? A medication. It's all about using medications to treat symptoms, but they're not getting to the cause of the problem. If we look at some general health statistics, we spend more money than anybody else on healthcare. We take more drugs than anybody else in the world. In fact, the United States is 6% of the world's population, and we take 72% of all the world's medications. Well, if we're told, if you have a problem, come to us, and we'll give you a medication to fix it. Well, if medications fix our problems, and we take 72% of all the world's medications, we should have the healthiest population on the planet if that model is correct. Yet in the United States, health conditions are the number one cause for bankruptcy. And if you follow this traditional healthcare model, 83% of Americans develop heart disease or cancer. In Okinawa, a third world country, only 1% of their population does. The World Health Organization, they come out with statistics every 4 years. And if we look here, the United States, we rank number one in how much money we spend per capita on everybody, but we are the health of our population. We're the 72nd healthiest country in the world. Well, we're not getting a good bang for our buck. So something's wrong. And the reason what's wrong is that we are taught to judge our health by how we feel. But every disease process known to man, the last thing to show up as a symptom and the first thing to leave as a symptom. If we looked at the two top leading causes of death that they tell us is heart disease and cancer, 800 to 750,000 people per year. Well, a lot of times the first symptom of heart disease is your heart attack, and 70% of the time you die. But your heart just didn't get, have a heart, your heart wasn't functioning a month, 2 months, 2 years. It wasn't functioning at 100%. It didn't just go from 100% function to a heart attack that day. The stats on cancer is that you have cancer developing in your body for 9 years before you get enough that you get a symptom, and then you go into the doctor to get it diagnosed. And the average is, once you get diagnosed, is they say the average is 4 to 6 months before you're what? Dead. Um, so it's very interesting. All these medical doctors, they did this research, and it was called Death by Medicine, and they just looked at the health statistics in the United States. They wanted to find out how many people died from properly prescribed medications and adverse drug reactions of medical error. And what they found was 420,000 people die each year from the medications and the error that they're given to us, that we're told is supposed to help us and get us better. Well, that's horrific. That's enough to be the eighth leading cause of death. When I got that article and read it, it was funny because it said, although the documented cases are 420,000, research shows that only 5 to 20% of these deaths are ever reported. Well, if you do the math on that, if 4 to 20,000 is the actual documented cases, and that's only 5 to 20%, well, the actual number is 2.1 to 8.4 million people die each year from what? The things that we're told supposed to make us healthy. That's equivalent to 35 to 147 47s crashing every single day for a year and killing everybody on board. If we just had one day in our country where 35 jets crashed and fell out of the sky in the United States, our FDA or the government would stop our flights and say, what the heck's going on? This is a public emergency and a crisis. Yet this is what's going on with our model all the time. And so why is it such a problem? Well, because again, symptoms don't show up until the end stage. I'm going to explain to you why here in a little bit. So we wait for symptoms to appear before we start anything. Then we take medications to cover up those symptoms. It's not getting to the cause of it. So we feel better, but the original disease gets worse. And as that gets worse, we also, over time, medications cause additional health problems from side effects, which then lead to more symptoms, which then we use meds to cover it up. We feel better. The original cause gets worse. We get side effects. It's called a positive feedback loop. This is brilliant. I mean, this is brilliant for pharmaceutical companies because they generate a lot of revenue with that, but it's not very good for our health and our life savings. Okay. In fact, talking about life savings, in 2017, Fidelity Investment, they said the average American, if you live your life like the average American, they said that you better have $260,000 for your out-of-pocket medical expenses by the time you and your spouse retire until you die. Out-of-pocket medical expenses. I tell my patients the reason this is so critical to start treating your body right is because I don't have $250,000 sitting in my bank account just for my medical expenses that I'm going to have to pay. So, I tell people about nutrition and they need to buy this good food, and they tell me, well, it costs too much. I'm like, well, you're going to pay now or you're going to pay later, you know? So those are the statistics, and they're absolutely horrific. So we just need to kind of go over that, and let's get you on the right track on what true health and what true healing is. Okay, now is this really healthcare? We get abnormal nerve system function into our body. We have the standard American diet, which is horrible, causes malfunction of the body. Lack of exercise causes malfunction. Toxins causes cellular malfunction. All of this stuff causes abnormal function of the body. That abnormal function expresses itself as a symptom. Those symptoms could be allergies, asthma, could be obesity, pain, headaches, migraines, cancers, diabetes, intestinal problems, thyroid problems, high blood pressure. Basically, all these are symptoms, and these are the things that cause bankruptcy. What do? We wait until we get these symptoms, and we use medications to cover all of these up. Use a medication so we don't feel the pain. Use a medication to bring our blood pressure down, instead of let's get to the causative factor. Let's remove the stuff that's causing abnormal function, and that's what we try to do here and try to teach our patients, so you can get your body healthy and healing. So what I want you to understand, and it's really critical, the pharmaceutical companies, they want you to think that you need to have their meds for everything. But the fact of the matter is your body is unbelievably smart. It's a self-healing, self-regulating organism. God doesn't make junk, okay? Your body needs no help to heal. It just needs no interference to the normal body function and those body processes. So again, like I said, we do a lot of lifestyle coaching. So we have a little, our lifestyle coaching, we have a little an acronym, says it's called our Renew program. It's about renewing your life. R stands for renewing your mindset. Listen, you're not going to get healthy unless you want to get healthy and you want to start making change in your life. And that's kind of the glue that sticks it all together. And then we have these fundamentals that have to be done. We have to energize your nerve system. Your brain controls everything in your body. And if you don't have a properly functioning nervous system, there's no way you can be healthy. We also have to make sure we get good nutrition in our body, because the foods that we put in, that's the only ingredients that we give our body for it to heal and repair itself. We need to get toxins out of the cell. Toxins cause abnormal cellular function, and toxins are the building, or excuse me, cells are the building block of life. We're made up of 70 trillion cells. So if our cells can't function, our body can't function. And we need to get into increase our oxygenation in our body, in all of our cells, because that's an oxygenated cell is what repels disease, cancer, and all of that stuff. Now, if you were to go out and hire a toxicity coach and a nutritional coach and somebody to go to the gym, and give you a workout, a personal trainer, it would cost $2,400 to $4,800 per year. We are here to save lives. We're here to help you. We include all of this. If you want to do it, it's $44 for a workbook. We send you videos. It's self-help, and we can kind of guide you on there. It's here for you. We do that for all of our patients, because we know we cannot get 100% function of our body if we do not start changing these lifestyle habits, okay? So just know that will be available to you. Now, let's get into what health is. Like I said, health is what? It's not how you feel, it's how well your body is functioning. We want to get to 100% life. And this is how we do it with these 5 essentials of health that we talked about. Now, the number one essential is nerve system function, like I was telling you, okay? And that's what we're going over here. You can eat all the great food and detox and exercise. You can do all this stuff, but if your brain is not communicated to your body and you're not sending those messages, it's impossible to be healthy. Impossible. This is the missing ingredient in healthcare today. The missing ingredient. And we're going to show you why. So if we look here, again, the brain controls what? Everything. Your brain, God is amazing. Your brain was designed to send messages down the spinal cord. Those messages go out all of these nerves to control all of the organs in our body. So for your heart to beat properly, for your lungs to breathe, for your intestines to digest food properly, these messages have to travel back and forth along these nerves at 100% level. Now, a normal spine, it should be nice and straight from front to back, okay? So my spine should be nice and straight this way, and then from the side view, I should have curves in my neck and in my mid-back and my lower back. That's normal alignment. And when we have normal alignment, there is no interference to these messages traveling back and forth along these nerves, and they run at 100% level. So with normal alignment, these organs are functioning properly, and you usually have an opportunity to be pretty dang healthy. Now, I always tell my patients, hey, if you were to cut this nerve going to your heart, what would happen to your heart? Well, it would stop. You would die. If you cut the nerve to your lungs, you don't breathe anymore. If you cut it to your intestines, they don't digest food. I mean, we learned this in 3rd grade, okay? Now, when people get what we call vertebral subluxation, that is just a a fancy medical term, meaning you get a misalignment in your spine, you start clamping down on one of these nerves that come out. Well, if these two bones right here get misaligned and they pinch down on this nerve that happens to go to your heart, and now only 50% of these messages are getting out to it, how well is it going to function? Well, it's going to function at 50%. It's not going to stop. It's not going to just quit working, but you'll start getting abnormal function. Okay, so the interesting thing is if we were to cut this nerve right here and we wanted to look at a cross section, that's what this is here. Inside that nerve, a nerve is kind of like a computer wire, and inside a computer wire is a whole bunch of little wires. That's all these little nerves in here. They're called neurofibrils. Well, there's a certain type of neurofibril called a nociceptor. Those are the nerves that's a protective mechanism. It sends the information of pain and numbness and tingling to your brain. Well, out of all of these nerves in here, only 4% of all the nerves packed in there send pain messages. The other 96%, they are all function fibers telling all of these organs to work and function properly. So research shows you have to get up to 40% compression of that entire nerve root. You have to compress 40% of it, which means up to 40% loss of function to whatever organ that's going to before you trigger enough of those pain fibers that you first feel that pain and symptoms. So a lot of times by the time people feel pain, they're like, oh my gosh, this happened yesterday, but actually it's been getting worse and worse and worse and worse. We'll go over that here in a little bit. Okay, again, symptoms show up when? At the end stage of the disease process. So sometimes a picture's worth 1,000 words. If these two bones are misaligned, we're compressing this nerve, and if it happens to go to the heart, what's going to happen? We're going to get abnormal function. It's going to cause abnormal cell growth. Okay, and that will cause what? Some sort of disease process. And the majority of time, we're going to be asymptomatic. We're going to feel fine. Okay, we have to get a lot of compression, right, before we start triggering the pain. So here's a spinal nerve chart. This just shows your spinal nerve roots from C1 to C8. They go to your eyes and your glands and your submaxillary glands and your heart and your lungs. And so if these get compressed, possible symptoms are migraines, headaches, dizziness, runny nose, coughs, colds, it's immune system function. You get sick all the time. We get down here to the thoracic spine, and these nerves go to, your liver, your spleen, your adrenals, So if we start getting a malfunction of those, then we can get wrist, hand, numbness in the mid-back, pain down into the arms. You can get into different heart conditions. You can get into different liver conditions, kidney problems. Your lower back goes to your intestines, your reproductive organs. You can get, so not only lower back pain, but pain down the legs. You start getting constipation, diarrhea, irritable bowel syndrome. So, symptoms, again, are your body's warning signal. So what's normal in the spine? I showed you on the spine right here, right? From front to back, when we look at your x-rays, we want our spine to be straight. So this is a neck x-ray. We want this spine to be nice and straight. We digitized your x-rays, so the green line on your x-rays is where your spine should be. Okay, the red line is where your spine is. So all you need to know when looking at your x-rays that we sent you, or when you come in to look at, is that the red line should be on the green line. Okay, so our spine should be nice and straight, and your neck and your lower back, your pelvis should be nice and flat and 90 degrees, and we should have a straight spine. Everybody kind of knows that. Looking from the side view of your spine, okay, here's your jaw, your teeth, this is your neck, you're standing and you're facing this way. Now, these curves, we should have a 42-degree curve in the neck, and we should have a 40-degree ellipse in the lower back. The back of these bones fit right along that. The next thing we look at is we want to make sure these discs are nice and big. Follow the outline of these bones, that everything is really, really healthy. That's normal. That's what we want to see. Okay. Now, these curves are critical because if we have misalignment from front to back, if we have a misalignment this way or this way, if I pinch on this one little nerve, well, it'll cause a problem to wherever that happens to go. If you pinch on a nerve down here, it'll cause a problem to whatever organ that goes to. But from the side view, when we lose these curves like this, we start compressing the entire spinal cord or stretching it, and then it can, wherever you have that abnormal alignment on the side view x-rays, that can start affecting any organs from there down because those messages start from the brain and go down. Okay, so we're always a little bit more concerned about the side view x-rays and the malfunction that it causes in the body. In fact, neurologists, neurosurgeons, people that do structural spinal correction like me, we have a little nickname for this curve in the neck, and it's called the arc of life, because research shows, I'll show you a little bit later, that the more we lose that curve in our neck, it starts decreasing lifespan. Okay, so what's abnormal? Again, if we look from front to back, the green is normal. This person's spine is shifted all the way over here to their left side. And then if we look here from the lumbar spine, again, same thing. Green is where you should be, and the red is where they're at. Okay. These are side view x-rays. Again, if we look here, this person has a complete reversal of their cervical curve. This disc is getting compressed, causing disc bulges, disc herniations, and this is a real, on a scale of 1 to 10, this is a 10 level misalignment when you get a complete reversal. The same thing here in the lower back, where, you know, this is posteriorly translated, but these two bones here are completely bent the opposite direction of what the curve should go. So we're getting a lot of nerve compression through there. So red line should be on green line. How do we get subluxation? Well, it could be from old falls or sports or micro trauma, sitting at the computer with your neck bent, or sleeping with your neck bent, or you know, repetitive things over and over and over. The birth process can cause this, you know, especially cesarean section or forceps. Motor vehicle accidents, but it doesn't have to be a really bad motor vehicle accident. Let's get into that. I have people and they've had a whole bunch of problems, and I'm like, you've been in a car accident, and they think they have to go to the hospital, but you don't. This is a 6-mile-per-hour accident. A 6-mile-per-hour accident causes 13 G's of force in the cervical spine. Okay, you would go away from this. Watch how far back his head comes back in slow motion. Okay, the body's the last thing to move. He may come away from this, you know, be sore for a couple weeks and then think he's fine. Well, guess what? The only thing that happened here was a little fastener broke. Insurance companies like to say, well, nothing was done in the car, so you're fine. Now watch how violent this is and how fast his head whips back. So what happens when you whip that spine? Now you're sitting there, you whip that spine real quick, and it rips all those ligaments, and then when your body heals, it heals with scar tissue, and then it keeps, and we live in gravity, and then it'll keep on bending and bending and bending and getting worse and worse and worse over time. So then 6 months, 7 months, 2 years or whatnot, as that gets worse and worse, then this person starts to compress the nerves and gets all these other weird symptoms, and he has no idea what's going on or what occurred. So as that spine gets worse and worse and worse, you start to get what's called subluxation degeneration. Okay, medical doctors term this bone spurring and disc compression and disc. It's all subluxation degeneration. So again, if we look at the side view here with a normal spine, like I said, normal curves, good disc spaces in there, everything's nice and smooth. The first phase of spinal degeneration is you get some sort of misalignment. Okay, you get misalignment, but if you look at these misalignments, we still have good discs in through here, and everything's nice and smooth. In this phase, if we catch it at this phase, you know, we do the appropriate care, we get you on the right rehab program, we should be able to get really good results to reestablish those curves, increase that nerve system flow, and get your body functioning and healing. If it is left like this over time, it will keep on degenerating, and it'll go from phase 1 to phase 2. Once we get into phase 2, now if we look here, now we're starting to get, look, see how crushed that disc is? We don't have those spaces. So again, if you heard of disc bulge, disc herniation, that's what causes these things. The only way you get disc bulge or disc herniation is if you have abnormal alignment and loading on that disc. Okay, and then you start to get all this bone spurring and arthritic changes. Now in phase 2, we're not going to get back to 100%, but we still want to get back to as normal as possible. If we get 50% correction, we double the lifespan of your spine. Okay, we also, if this is causing, you know, 80% abnormal function of your nerve system, let's try to get to where you only have 20% abnormal nerve function of your nervous system. At minimum, we want to make sure we stop this, because we do not want it to go to phase 3, because once it goes to phase 3, that's when the joints fuse, we get immobilization, bone fusion, and it's past what we can fix. We can't help at that time. That's when I'm sending those people out to surgery. So this is what it looks like with the spine. In phase 1, we got still good discs, and then phase 2, we're getting some of those arthritic changes and disc compression and disc bulges. We can still get some correction, but we do not want it to go to phase 3. This shows degeneration with an x-ray over time. So we had a normal curve, good discs, everything looks good. And once it starts bending, gravity takes over. It keeps bending and bending and bending. And as it keeps on bending the wrong direction, we crush the spinal cord. We start smashing these discs. They start to squeeze down and those discs bulge out. And then we start getting all these arthritic and degenerative changes. And then the bones fuse. And then we're off to a surgery. That is the process. Okay, so we, again, on a model, we have a nice healthy disc. We start losing it and we start squeezing it, and that's how you get those disc bulges or disc herniations, is by squeezing it out. So why is it important to do corrective care and get these things back to normal and get these curves back? Well, because if you don't, you go to surgery, they're going to try to do it. They'll put these rods in, they'll try to screw them into that more normal position, okay? But you know what the problem is? Average surgery costs $82,000, and people do pretty good for 2 to 5 years. But after that, depending on the research, it's an average. They have about a 74% failure rate, because once you start fusing stuff, then the next, it's called adjacent segment degeneration. The next segment starts wearing out, then the next one, because our bodies weren't made to be stuck and frozen like that. Okay, so I mean, I have people that already had a surgery and we still have to do the correction afterwards. So why don't we just correct this prior to the surgery and not pay $80,000 to fail 74% of the time? This right here, this is a side view of the neck, and what this is here, this is an MRI. Basically, side view of the neck with these vertebrae. We're looking at this just like this, and we're looking at that hole, and this is where your spinal cord is, right here. So when we have a good curve like this, that spinal cord is relaxed. It has some coil like a phone cord, and it's nice and big. We lose this curve. We have a 10 degree curve instead of 42, a 75% loss, and then look what happens to the spinal cord. It starts to stretch it, and it just gets squeezed down like this. If we want to look at a side view x-ray, here's a neck. This person was facing the other way. Their neck is bent the wrong direction. Here's a side view MRI where here's their brainstem, their spinal cord, and look what it does. All those life-giving messages can't get down for the function to the rest of their body. So just some quick little tidbits on when I explain this, sometimes people, I don't know, they don't believe me, but I just grabbed little tidbits and just on literature real quick. Dr. Brigg, MD, said you stretch the spinal cord 5 to 7 millimeters, it puts your body in a state of disease. Core says it reduces lung capacity up to 30%. Spinal subluxation, losing these curves, is a major factor in all disease, including cancer. That's Dr. Reich. It can affect the hearts, the lungs, the digestive system. Renee Callier. It shows 100% correlation with diseases of the internal organs. It weakens the immune system, causes organ disease, muscle tension, increased sensitivity to pain, can lead to intestinal issues, osteoporosis, poor overall health, quality of life, shortened lifespan, leads to things like fibromyalgia. And then this is the research from the Journal of Bone and Joint Surgery down here that says complete reversal in the cervical spine can cause up to 14 years off of lifespan. Journal of Geriatrics came up with one that said you get some of these kyphosis in your spine, it can take up to 20 years. So as we're restoring these curves, not only are we getting you out of pain, we're restoring function, taking pressure off the function fibers, and we're actually adding years of what? Of life when you're looking at the research. So here's some just sample patients that came into my office. People call miracles. They're not miracles. It's just allowing your body to start functioning how God intended it to. So this person that came in, we've already seen these x-rays, but when they first came in, this is the one that had the 10 degree curve, 75% loss. They had daily migraines, high blood pressure, allergies, 20/50 vision. They came in because they had migraines. We start working on this curve. Not only did their migraines get better, they still had some. Healing takes time, but their blood pressure returned to normal. They had no more allergies. Their vision improved and went back. This person was a teacher here in town, had a complete reversal. She had all these sinus problems, had a $75,000 sinus surgery where they drilled up into her nasal cavity. But that's where your immune system resides, right? So she was always sick and having all these problems. Well, she has a complete reversal in her spinal cord. So that surgery, guess what? It didn't do anything to help her sinus problems. But she was also had insomnia, obesity. She was taking all these meds. She was infertile. She was told by 3 different doctors she would never have a baby. Here she is a year later, restore that curve, no sinus problems, no dizziness, insomnia, normal weight, off all of her meds, and guess what? She happened to get pregnant. Now, I'm not an infertility doctor. I didn't know if she would get pregnant or not, but I've had 4 or 5 different ladies throughout the years who we start working on their nerve system, get their nutrition, and guess what? Their body starts to heal and function, and they're blessed with babies. So um, this little girl here, Kellyanne, had this weird autoimmune disease. They don't know how to treat it medically. She had a complete reversal. This is caused from cesarean section. You know, those cesarean section and forceps delivery can cause reversals in the cervical spine. So a lot of those kids with ear infections and things like that, and they keep on having these issues, it's probably a hard childbirth. So that she comes in here. Here she is 12 weeks later, got a great curve, right? Well, the reason I put this up is that kids respond fast. If she's left like this, she's going to keep on getting worse and worse and worse. And then, you know, we don't have to do as much therapy on a child because the scar tissue hasn't been there as long. So we need to get our kids checked, okay? Because we don't want to wait for all the pain and symptoms. Okay, and this little guy went to school here in town. Chronic ear infections, sinus problems, allergies, intestinal problems. Parents spending almost $800 a month in meds, had to be pulled from school because he was getting sick all the time. Well, he had a complete reversal in his upper cervical spine. Guess what this is caused from? Another childbirth. He's always been sick, always a sick kid. Here he is 12 weeks later. It's not back to normal yet, but even here, ear infections resolved, no sinus issues, and allergies got better, back to school, off all of his meds. So again, the power of the body can heal the body, okay? There's a time and place for meds. I understand that. We need meds sometimes, right? But just to take a med for every single problem and not look at the root cause first at all is crazy. It just doesn't make any sense. I mean, if you have a misalignment, sometimes I have people watch this and they go, I'm going to go get a second opinion. I'm going to go, okay, well, if you have a misalignment, it's compressing this nerve and it's causing pain in your back and it's coming down your arm. I don't care how many medications you take. You can take every pill in the world. It is not going to recorrect that spine and take pressure off your nerve. So it's just crazy that's the gold standard, is to numb it. Now, all those x-rays I showed you, we got great correction. We don't always get great correction, you know. It's a bell curve. Sometimes people get 0 correction. Some people get 100% correction, but 80% of the people, they're kind of in here. It just depends on how much damage was there and how hard you work at it. So this is a more typical example of what you'll see, what you can expect. This gentleman was 68 years old, 25 years of abnormal heart function, had a couple heart attacks, was on all these meds. His head was shifted 49 millimeters forward. We start working on him. 3 months later, we shoot an x-ray. He went from 49 millimeters forward to 36 millimeters. 3 months later, he's down to 26. So we went 13 millimeters, 10 millimeters. And then we get to this last one. It only changed 2 millimeters. It's really starting to slow down. So he's probably not going to get to 100% correction. But what would you rather have? Would you rather have 80% function of your nerve system or 20%? Okay. Your brain sends those messages. It's kind of like water. If your organs are all the plants, and your brain's a water reservoir, and all your nerves are all the garden hoses. So if you squeeze that hose and it's just dripping water, your body's not going to do really well right here. But if we can get a bigger stream of water going there, you're going to have a healthier plant, i.e. a healthier heart, a healthier lung, or a healthier intestines, wherever those nerves are going to. Okay, so again, remember, 100% function is 100% life, and we have to get 40% loss of function. So we're only at 60% function at the nerve root level, right? Because only 4% of these are pain fibers before we feel our first symptom. So when we get in, what we're going to have to decide with you is what your goals of care are. If you're looking here, your spine is here. Basically, if your spine is bent all the way this way, really bad like this, we can move it from 40% to 39% like this. We can go from this side of the symptom line to this side of the symptom line, and you can feel great. You can feel so much better, and you're not triggering enough pain fibers, and you feel good. But how well is your function? We're still clamping on all these function fibers, okay? So the decision is, do we keep on going and trying to get this back to normal? Do we try to stabilize it here, or do we just get out of pain and you call me back? And we're going to go over those in the next little slide here. Dr. Sue at the University of Colorado said the weight of a dime on one of these nerves can cause up to reduce nerve supply by 60% in just 3 minutes. So it's critical to get pressure off. Let's look at this. Okay, this explains the lifestyle of one of our chiropractic patients. When you first come in, you're down here. If we look here, your bone is compressing on this above 40%. You're in, so you get the severe pain, and you're getting little drops of water. Then this, wherever that nerve goes, we got a little heart meme or whatever this is called here. So this heart's not doing too well, or if it's lungs or intestines or liver or whatnot, it's not doing well. Okay, so you're getting abnormal function and disease. So people come in here when they're suffering. Each one of these little dots represents an office visit. So this beginning at this relief phase, sometimes when we first start, sometimes you may get a little bit worse before we start getting better, trying to unstick. Sometimes it's get a little bit tender, okay? And sometimes people get faster results, or they're nice and even steady results, but our goals for the relief phase to get you feeling better as soon as possible, get you moving better as soon as possible, get you back to work and your activities as soon as possible. We want to get you feeling better as soon as possible. We want to get up here. When we get up at this area, once we get to less than 40% compression, at that point in time, if you look here, boy, not as much compression. So we have mild to no pain. However, slight improvement supplied to the organ. Disease is still taking place. So maybe we're getting 2 drips of water. Does that make sense? Now's a decision-making process. What you can do is say, Doc, I'm great, no problem. That's fine. Well, it's bent like this. We bent it a little back more. If we stop, then I just say, call us when you have another flare-up, because we live in gravity, and over time, guess what? It's going to keep on bending back this way, and you'll have a relapse. And by the time you get sick of all that pain and gets unbearable, then we'll have to hit a whole bunch of those visits to get you up above this pain line where you're pain-free. And then you wait again, and then a whole bunch of visits, and then you wait again, a whole bunch of visits. It will come a time, as you see sometimes it'll get to the point where once that damage, the longer it stays there, we get that degenerative phase from phase 1 to phase 2 to phase 3, and there will come a time that chiropractic no longer will help you, okay? And there won't be anything to do. But some people like to, that's what they, I don't know, they choose that. The other thing we can do is what we call a relief, get you out of pain, then do what we call a patch care. Now, patch care, our goals for patch care is we manage your symptoms, reduce your relapses and the associated costs, and slow down that degeneration. So if we look here for patch care, basically, we get you out of pain, and then we just, hey, see you every once in a while, trying to keep this thing from bending and just keep you out of that pain level. Now, we're still going to degenerate, and we're still going to have some flare-ups here and there, but we're going to have a lot less, and we're definitely not going to have as many visits, so you're going to feel better, and your body will function a little bit better, and we're slowing that process down. Last but not least is if, hey, we're feeling better, we're doing good, and then we go on through corrective care. Now, our goals for corrective care is to achieve maximum spinal alignment, restore maximum nerve flow to organs, reverse or stop spinal degeneration, and eliminate or prolong the need for any surgeries. So if we look here, we have a lot more water coming out to that heart. It's starting to heal and function, and our goal is we're working towards 100% or 0% nerve compression and 100% health. We want to get as much correction as possible, okay? So now to do this, we're in the next slide, we're going to kind of, this we have muscles and ligaments that attach to those bones, and we have to rehab all this. This is when you got to do a lot of work on your own. Some people are willing to do it, some people aren't. So we just have to make sure we're on the same page. When you come in here, relief phase, listen, we're here to help people. We're here to save lives. Again, like I said, so we've got to try to make that affordable for folks, and we'll explain how we've done that. But basically, if people need payment plans, relief phase can be anywhere between $32 to $83 a month, just so you know. If you're doing a relief and then you say, Doc, let's do a relief and a patch, you're looking at around $119 to $144, depending on your insurance and how bad your problem, what your insurance coverage, or if you don't have insurance. So that's kind of the range. And then corrective care, depending on your problem and insurance or whatnot, it averages out of pocket about 165 to 340. So we've really done a lot to try to keep our fees low. I mean, they're They're not free, but they're fair. Okay, so people can get the health of, or the help that they need. Let's get into this corrective care, because if you're really serious about correcting these problems and getting your health and your life back, well, then you'll have to understand there's some therapy. Again, these joints, we have ligaments all over the place. We have all these muscles. We have to rehab those to get things to hold and stay. Okay, it's like bracing your teeth. It takes a while, and we need to know if we're doing corrective care, because we want to be using all these visits and do all that rehab with it. Okay, so you'd be doing in-office therapy. You do the adjustments which help improve your nerve system function. There's wobble board, standing cervical traction that helps rehydrate your discs and your ligaments, and helps open up those arc of life. And then you'll be doing this head weighting or shoulder weighting. It helps reprogram your brain. So if your head is shifted over here, you'll put these little weights on your head on this side. It makes those opposite muscles contract, and it's resetting that brain. And then they're on vibrating platforms. So that's what you'd be doing. The office visits take about 10 minutes. We're really on time, and it takes about 10 to 15 minutes in the office. But we have to. That's really, really critical. We have to rehab all of these structures. At home, you'd be doing some spinal molding, basically these little sleeping aids, just to open up those arcs, those curves in your spine when you're trying to sleep, so your body can heal and repair. Until we get things back to normal, we want to artificially open them up, because at night times when our body heals and repairs. So that's not hard to sleep on them. Isometric exercises that helps re-strengthen postural muscles. So again, if your head was shifted this way, we'd have you strengthening that muscle into your hand and doing exercises every single day. And dental orthotics, that's to help stretch the ligaments. So we lose those curves. It's a harder foam roll. We're trying to reshape those curves and stretch them, and then strengthen the muscles to pull it back, and do the adjustments to break up scar tissue and increase nerve system function. So, your home rehab, it's probably 10, 15 minutes a day. It's not hard, but if you're not going to do it, you're not going to get results. So don't waste your money on corrective care, okay? So if we go to the other thing I want people to understand with corrective care is the majority of the time you feel what? You feel great. So that's why you have to keep doing it, because we're following up with the x-rays. So yeah, we're going to feel good, but we're trying to increase function and stop that degenerative and disease process. Okay. Your x-ray report, if I happen to have sent you this, the code to get in, the unlock code is 1895. That's the year chiropractic was invented. If I haven't sent it to you yet and you're coming back in to look at your x-rays, this just explains to you what we're going to be looking at. But on your x-rays, you're going to have a normal. On your report, you're going to have a normal, and then what yours is. Yours is always going to be on the right, so it'll show. And then this is the cervical spine or the neck. It will show this. You have 7 cervical vertebrae in through here. These are what the measurements should be. Like normal blood pressure, 120 over 80, right? And this is what your measurements are. And then this column is your difference from normal. Biggest thing to notice here, the really big problems from the side view is this negative sign right here in front of these. All this means is you were standing and you took the x-rays, you were facing that way along the negative x-axis. So that curve should be pointing that way. If we don't have that negative sign, that means you have a 4.5 degree curve, the opposite direction, and that's where we're compressing your spine, kinking your spinal cord, compressing those discs, and we're getting a really big problem in through here, 156% the wrong direction. Okay, this here just gives us kind of an average of total loss. And then your lower back, same thing. Normal, what a normal spine is, what yours is, so you can kind of compare. You can show it to your spouse. And then your lumbar spine, those vertebral segments, what they should be, what they are, and your difference from normal. Okay. So listen, I love research. This is one of my favorite research articles. If you put the time and energy, it's more costly right now to do corrective care, but you save the most in the long run. I love this research. It's from the journal Manipulative and Physiological Therapeutics. They took 300 people, 65 years and older, and they took another 300 people that were healthy, and they 65 years of age and older, and the people that did chiropractic care and had their nerve system functioning, for 5 years, they just tracked their health. So people were healthy starting off, and then they did nothing. And people were healthy starting off, but they did chiropractic care. The differences are this. Those people working on the nerve system function had 50% less medical provider visits, 60% less hospitalizations, 62% less surgeries, and 85% less pharmaceutical costs. And they only spent 31% of the out-of-pocket costs that these people did. On average, because they're 65 years of age and older and your body's starting to wear down. That was an average savings in this study of $6,000 per year. It was a 5-year study, so that means these people saved $30,000 over people who were so-called healthy and just waiting for symptoms. Okay, so what you do now and how you treat your body is going to make a tremendous impact in your health now and into the future. Okay, so at your next visit when you come in, listen, we're going to answer any questions you have about your spine. If you look at if you have your x-rays and look at them, great. If we haven't gotten them to you yet, we will be looking at them then. So we'll answer any of those questions. We're going to go over, we'll have called your insurance if you have it. We'll figure out what they pay for corrective care, patch care, relief care, and then we'll have what it would be for your cost out of pocket. So we'll talk about what your goals are. What do you want? Do you want to correct it? Do you want to just patch it? Do you want, hey doc, just get me out of pain? We can do any of those things for you. It's your body, it's your health. I work for you, I want what you want, but I want to make sure we're on the same page, because if your spine should be here and yours is here, getting you out of pain, moving a little bit is much, much different than trying to get things back to as normal as possible. As long as we're on the same page, then we're good to go. And then depending on what your goals are, we'll set up your treatment plan. So if you have a spouse or significant other that's part of this decision-making process, bring them to this next class or watch this as they watch this video. If it makes sense to them, if you've seen the x-rays, and then they can say, hey, yeah, correct it, honey, or, things are tight right now, let's just patch it up, or, just get you out of pain. But this is that a decision-making process at the next visit, because we are setting up those plans. So bring your schedule with you, bring a method of payment, so we can kind of get your care plan going and get you on the right track to health and feeling better as fast as possible. So listen, again, like I said, we're on a mission. My mission here is, again, to save lives physically and financially. I hope this makes a lot more sense now. How do we save lives physically? Well, geez, by getting pressure off your nerve system, right? And restoring nerve system function. When people do that, they don't get all these disease process. They're not in surgeries. They don't have all this sickness and disease. When people start doing corrective care, they come in because they have pain, but then they lose 30, 40, 50 pounds. They no longer have type 2 diabetes. They no longer have asthma or allergies. It's amazing what your body can do. How do we save people's lives financially? Well, the average American, if you follow that model and eat horribly, don't get your nerve system correction, don't get rid of toxins, don't exercise, you will develop malfunction, and 86% of the time you're going to develop heart disease or cancer. And once that happens, your life savings will go down the tube. You'll work your whole life and it wipes you out. It's a great model for pharmaceutical companies and people that are doing, surgeries and things like that, but it's not a good model for you and your health and your family. I want to tell you a little story real quick before we end here about Carla. Carla had some pain in her knee, right? So went to the doctor and they say, here, Carla, take a pain medication. Did that fix the problem? No, it just numbed it, right? The pain's protective mechanism. So she goes back, she's like, hey, the Motrin's not working. Okay, here's some Vicodin, Carla. 6 months later, the Vicodin's not working. Okay, here's a cortisone shot, Carla. Oh, that's great. She felt great for 6 months. Then she goes back in. Hey, it's hurting again. Give me another cortisone. They do another cortisone shot, and as they do that, now all of a sudden that cortisone shot didn't work at all. And then they take an x-ray and they go, oh my gosh, look at all this degeneration and arthritis. Well, we have to do a surgery now. Well, then she goes and gets a surgery. It's supposed to be a day in, day out procedure. She's on the operating table and she ends up in that surgery, she gets a pulmonary embolism and she dies. Now, what happened with Carla? So they keep on, as we treat a symptom, the problem gets better or what? Worse. So they started with Motrin, problem got worse, Motrin doesn't help, give something stronger, Vicodin. Problem got worse, doesn't help, then we do the injections, another injection, then, oh my gosh, look at all this damage, now we got a surgery. And along that time, are the therapies getting less expensive or more expensive? More expensive. And then all of a sudden it gets to the point where she has a surgery and she dies from a simple procedure. Well, you guys, Carla was my mom, okay? I have in my office, I'm here to teach the truth about health and healing because I've been through this. I understand what following that model does, and that happens to people all the time, all the time. And when my mom died, we had to pay for her surgery. You know, she's a single mom. She worked as a secretary. We had no money. We had to sell the house to pay off this for the surgery that killed her. I was like, I'm not paying for this surgery. You guys killed her. And they're like, well, she signed right here. There's a risk of death. So, I mean, you know, the procedure was done. The doctors need to get paid. So I want you to know if you do corrective care, it is more expensive because we have more visits and x-rays and rehab and all that stuff. But I only accept cases I truly believe I can help. You will see in our office policies, if you do everything, if you work your butt off, if you happen to not get results, if I was mistaken that you know, it was past what we can fix, I will never do that to somebody. You can rest assured. I mean, it's in my office policies. I'll give your money back. So I'm just never going to do that to somebody. I want people to know where my heart is. So anyway, guys, I'm glad you were able to watch this video. Once you come in, if we're doing relief care, if we're going to do patch care, whatever you're doing, just know, again, this is about saving lives. Your entire family, you have 1 week's time to come in at no charge to get x-rays done, to check for subluxation. Subluxation is rampant. It's from falls and injuries and things that have happened. The longer we're on this planet, the more opportunity. It is epidemic levels. So usually it's not if you have subluxation, it's how bad. But we need to find this stuff before you get to symptoms, before we degenerate, so we can correct it as easily as possible. So again, that's my free gift to you. Make sure that you get them in here, and let's get them looked at, and get them on the right path to health. So hey, look forward to seeing you, and we will talk to you soon at your next appointment. Thanks. Bye.